Are you over 65, or do you have a loved one who's entering their golden years? Well, today I'm about to reveal the 5 most dangerous medicines I would never let my loved ones take. These medications might seem harmless, but they could be wreaking havoc on health, causing irreversible damage without anyone even realizing. You'll be shocked by what they are and why they're so dangerous. You won't believe number 3. It might just surprise you to the core. Stick with me because this could save a life. Introduction. Well, let's begin by talking about the importance of medicine safety in older adults. Although many medicines are prescribed to treat symptoms, some can do more harm than good, especially in the elderly. Now, let's unravel the 5 dangerous drugs that are frequently used by those over 65. Benzodiazepines. These anti-anxiety medications are commonly prescribed to older adults, but they come with a host of serious risks. Here's a shocking fact. Research shows that benzodiazepines are linked to an increased risk of dementia. In fact, long-term use can cause memory loss, confusion, and cognitive decline. These medications can lead to falls, fractures, and accidents, especially in the elderly, who already have weakened coordination. Even though benzodiazepines help with anxiety, the risk of addiction, dependency, and cognitive decline outweighs the short-term relief they may provide. We should seek safer alternatives like cognitive therapy. Anticholinergics. This class of drugs is used for various conditions, including allergies, colds, and insomnia. But what many don't know is that they're incredibly harmful to the elderly. Here's a shocking fact. Anticholinergics block acetylcholine, a neurotransmitter that's vital for memory and learning. Prolonged use is directly linked to an increased risk of Alzheimer's disease. The side effects of these drugs include confusion, hallucinations, and memory problems. For seniors, these risks are heightened. It's not worth the risk of irreversible memory loss. There are safer alternatives, like using non-anticholinergic antihistamines or seeking natural sleep aids. Opioids. Opioid painkillers are often prescribed to older adults to manage pain from conditions like arthritis or back pain. But here's a shocking fact. These medications have caused a nationwide epidemic of addiction and overdose deaths, but seniors are also vulnerable to their deadly side effects. Opioids are highly addictive and can cause confusion, constipation, respiratory depression, and in extreme cases, overdose. They can also interact with other medications to increase sedation, making them even more dangerous. While opioids are effective for short-term pain relief, there are non-addictive pain management methods like physical therapy, acupuncture, and CBD. Chronic use of opioids should always be a last resort. Proton pump inhibitors, PPIs, example Nexium, Prilose, and omeprazole. PPIs are commonly used to treat acid reflux and GERD, but they're often overprescribed. Here's a shocking fact. Long-term use of PPIs can lead to serious issues like kidney disease, osteoporosis, and even stomach cancer. They also interfere with calcium absorption, which can increase the risk of fractures. The risks increase with prolonged use. Older adults who take PPIs for years often end up with weakened bones, kidney problems, and nutrient deficiencies. It's not worth the risk of irreversible memory loss. There are natural alternatives for acid reflux, such as dietary changes or using antacids in moderation. Antipsychotic drugs. These powerful sedatives are often prescribed to seniors with dementia or psychiatric conditions, but the dangers far outweigh any perceived benefits. Here's a shocking fact. Studies have shown that antipsychotics are linked to an increased risk of stroke and death in elderly patients with dementia. These drugs are powerful sedatives that can cause severe side effects, including weight gain, diabetes, and heart problems. They can also worsen symptoms of dementia and cause severe sedation, making individuals more prone to falls and injuries. The risks associated with antipsychotic drugs far outweigh any potential benefit. Non-drug therapies, such as cognitive behavioral therapy and environmental adjustments, can be more effective and safer. In conclusion, Let's reiterate the importance of speaking with a healthcare provider before taking any medications, especially as we age. Encourage you to be proactive in seeking safer alternatives and advocating for better treatment options for your loved ones. Now, with a strong call to action, if you value your health or the health of someone you love, don't let them take these dangerous drugs. Share this video with friends and family so they can stay informed and make safer choices.